Welcome to Surrey Place Centre's online learning opportunities. The School Support Program presents Understanding Autism Spectrum Disorder. Have you ever found yourself in a situation where you couldn't rely on your first language? Preferred visual instructions when assembling furniture? Jumped into a conversation only to realize that you're talking about the wrong topic? Written a grocery list before you go shopping? Become anxious when your schedule suddenly changes? Relied on your day timer? Avoided large crowds? Removed the tags on your clothes because you found them bothersome? Cringed at the sound of nails running down a chalkboard? You may have answered yes to one or two of these questions. We all have preferences and sensitivities. The difference is that students with autism spectrum disorder will likely have many more. Having most or all of these types of traits, like preferring visual information, misreading social cues, requiring tools for organization, sensory sensitivities, and trouble with change can make daily life much more difficult. The terms autism, pervasive developmental disorder, and autism spectrum disorder, otherwise known as ASD, are often used interchangeably, and this can be confusing. Pervasive developmental disorder is an umbrella term defined in the Diagnostic and Statistical Manual of Mental Disorders, version 4, by the American Psychological Association. This label was used to describe a class of disorders characterized by impairments in social interaction, communication, and inflexible or often routinized behavior. These disorders include autism, pervasive developmental disorder not otherwise specified, Asperger's syndrome, childhood disintegrative disorder, and Rett syndrome. The term ASD has been introduced to describe a subset of three disorders under the pervasive developmental disorder umbrella: autism, pervasive developmental disorder not otherwise specified, and Asperger's syndrome. The diagnosis of these disorders is based on behavioral rather than medical criteria. There is no single test or cure. From this point forward, we will be talking only about these three disorders because they are the most common diagnoses and the ones that are most likely to be seen in a classroom or community. Rett syndrome and childhood disintegrative disorder are somewhat different and more rare. Autism spectrum disorder occurs more often in males than females, at a ratio of 3 or 4 to 1. ASD may be more common than previously thought. The diagnosis of ASD has become more common due to a widening of the diagnostic criteria, which has made it more sensitive to milder cases, early detection, and greater access to developmental assessments. There is no direct evidence that the incidence of the disorder is increasing or that ASD is an epidemic. Recent studies have found that ASD is diagnosed in 60 out of 10,000 children, or about 0.5% of the population. The Canadian Autism Intervention Research Network supports a prevalence rate of 1 in 165. In the U.S., the Center for Disease Control reports 1 in 150. This means that autism will affect more children than AIDS, cancer, and juvenile diabetes combined. In Canada, ASD is most commonly diagnosed by a psychologist, psychiatrist, or developmental pediatrician, using the criteria set out by the Diagnostic and Statistical Manual of Mental Disorders. Although there currently is no cure for ASD, applied behavioral intervention is the most effective treatment option available to families with young children right now. Each individual with ASD is affected very differently, and symptoms can range from mild to severe. This is why it's often referred to as a spectrum disorder. Regardless, the core challenges in communication, social interaction, and behavior are always present. We have learned a lot about ASD, but we still don't fully understand the exact cause, and we continue to investigate. We know that autism is neurological, lifelong, and that it's found worldwide regardless of ethnicity and socioeconomic status. Current research links ASD to differences in the brain, and there is strong evidence of a genetic component from studies done on twins. Many researchers have found structural differences in the brains of individuals with autism spectrum disorder compared to persons without. The brains of individuals with ASD grow more rapidly at a young age. A 2-year-old with ASD may have the brain volume of a 16-year-old. Age 2 is a critical time for forming connections and ensuring proper wiring of the brain. Early brain overgrowth interferes with the brain's ability to form connections between distant brain areas. This overgrowth precedes the behavioral changes associated with autism. Research has found the main area of overgrowth is in the front of the brain, called the frontal cortex. The back of the brain, where processing visual information occurs, is relatively unaffected. Temple Grandin, a successful entrepreneur living with autism spectrum disorder, describes the brain connectivity difficulties in ASD.
Imagine that the brain is a big corporate office building. Up at the top of the office building, you have the chief executive officer. That's the frontal cortex. Now, that frontal cortex has got connections to all the different departments that are inside that office building. You've got the social department, that's sales. You've got the math department, finances. You got a graphic design department to do your advertising. You have all these different departments. And white matter is the brain's communication wires between the different departments. It's sort of analogous to telephone connections, email connections, instant messaging connections between brain departments. What happens in autism? A lot of those connections don't get connected.
The area shown in pink is the frontal cortex, the area most affected by brain overgrowth. This area is responsible for interpreting complex socio-emotional information like deciphering emotions, understanding the impact you have on others, putting yourself in someone else's shoes, making quick judgments about people and their intentions, and recognizing that others have thoughts, feelings, and motivation that is different from your own. All of this awareness is needed to understand social situations and have empathy for others, which are critical for building lasting relationships. Abstract reasoning and the ability to plan, prioritize, and make decisions based on information collected are also impaired. Fortunately, our brains are very plastic and able to compensate for the difficulties they experience. Whether or not compensation happens, we all have multiple intelligences, strengths, and weaknesses in different areas and subjects. For example, due to brain differences in wiring for persons with ASD, they may be more likely to process information in small chunks. In other words, people with ASD tend to be detail-focused. This may make it hard to remember the gist of a story, but it can be an advantage if you're trying to recall a specific fact, recreate a block design, or remember the notes in a chord when playing guitar. All of the autism spectrum disorders share challenges in communication, social interaction, and behavior, but how this looks will be different for each individual. Like the saying goes, if you've met one person with ASD, you've met one person with ASD. Let's take a closer look at the 3 diagnoses under the ASD umbrella. Autism is a developmental disorder characterized by difficulty with communication, social interaction, and atypical behavior, including unusual responses to sensations, repetitive movement, and inflexibility. As many as 70% of children with autism are also developmentally delayed. Caregivers may notice symptoms as early as 12 to 18 months of age, often with a diagnosis by the age of 3. Many children with autism will never develop functional language, although early intervention is helping. Pervasive developmental disorder, not otherwise specified, is a diagnosis used when a child has fewer or less intense symptoms than required for a diagnosis of autism. These students often have better language and cognitive skills than students with a diagnosis of autism. Asperger's syndrome has only recently been recognized as a separate disorder. Asperger's syndrome is characterized by social, communication, and behavioral impairments. These individuals don't have significant cognitive or language delays. People with Asperger's have above average to average IQs and may be in the gifted range or have special, exceptional skills or talents. Despite this, they can be very literal and have difficulty using language socially. Often they may be clumsy or awkward with their motor skills. Because the social communication deficits aren't as obvious as with autism, and they are functioning at such a high cognitive level, these individuals may slip through the cracks and be diagnosed much later. The social pressures of middle school and high school may make these symptoms much more noticeable. Now that you have some background information about autism spectrum disorder, go to the next module and learn how this will impact you as a teacher.